drinking levels. Now the other two waters that she was talking about is another setting on our machine, and that is a 2.5 acidic water and an 11.5. The 2.5 is an extremely valuable water, and by the way, we make these at the same time because when we're splitting the water, if we got 11.5 coming out the upper tube, we obviously will have 2.5 coming out the drain tube. We capture both of those. The 2.5 we use to disinfect anything and everything in our home. If we have a skin problem, a sore, a burn, just anything on the skin, psoriasis, okay? Anything below 2.7, this water will kill. Now, you can have it in your hand. It's not like having acid, okay? But it's a very acidic water. It's a great disinfectant. At the same time, the 11.5, being a very alkaline water, can clean things amazingly. I can take spots out of carpet. You can clean a car engine.
Really?
Yeah, it'll cut grease, cuts oil. We actually put in a couple of quarts into our wash machine, and we don't have to use soap. So people that are soap sensitive can literally do their laundry by throwing in a couple of quarts of this 11.5.
So you can substitute an 11.5 alkaline water for soap.
Absolutely.
Well, then lye then is very alkaline, right?
It's very alkaline. It has a taste kind of like Alka-Seltzer.
Okay, yeah, so very salty. Okay.
The 2.5 actually has an odor to it, almost smells like chlorine.
It's bleach, right?
Yeah.
I've smelled the 2.5 smells like bleach.
Yeah.
So that's what you would disinfect. Could you actually put it in the washing machine as a bleaching agent?
Yeah.
It would bleach things.
Oh yeah, it will.
Okay.
But so the 11.5 can be used a lot of ways now. Like in Joyce's husband's situation, she took the 2.5 to help kill that psoriasis, and he put this on the skin topically. Okay. Then he took the 11.5 to clean off what he did with the 2.5, and then he used what we call a beauty water, or a 5.5 acidic water, which brought the skin back to its natural pH. And she would treat him a couple times a day this way.
Wow.
Just putting it on a pad and soaking it on his arm for 10 or 15 minutes, 2 or 3 times a day.
That's incredible.
And it literally just killed
and
got rid of the psoriasis.
So then you started doing this and your arthritis cleared up?
Yes.
You had knee problems you talked about, your shoulder problems. So what I know is that from medical training that when you have bursitis, all of our joints are encapsulated in sort of a sac, and the word bursa comes from the Latin for sac. So when you have bursitis, it's simply inflammation of the sac. And what it is what we learned in school was that, well, it's because you're not getting enough water inside the bursa, so you're not getting lubrication, and that's why you get the pain of the arthritis, and then it heats up, you get bone change, you get the spurring. So, but with the alkaline water, you're actually hydrating, because I've heard the word that the alkaline water is actually wetter water. Is that true?
Because it's microclustered, it gets into your cells immediately.
It gets in better. It actually finds receptors that are more acceptable to the microclusters instead of the random clusters. So are the microclusters actually smaller, makes them smaller than the random ones?
Yeah, instead of having 18, 20 molecules per cluster, you're back down to 4 or 5. So obviously, if the cluster is that small, it can actually get into the body and penetrate at the cell level.
So it actually then starts rehydrating the bursas around the knees and the shoulders and the hips. Everywhere you've got a joint, you've got an encapsulation. So with the wetter water, basically, it's getting in there and rehydrating these things and releasing the problem. It's like adding oil to your engine once it's out and it's heating up. So that's really interesting. Because I also have a book here called Alkalize or Die.
Exactly.
And it goes on about the fact if we're not hydrated, we are going to die. We can't go very long without water. And you had some things to say about this. You've got a newspaper with health news there. This is something that anyone can pick up anywhere, right? Not anywhere, but where would you where would someone pick up a health news?
Well, I leave them in doctor's offices now and then.
Oh, okay.
And in other stores.
Okay.
I've left them in coffee shops on the counters.
Coffee shops,
just
counters.
anywhere.
Anywhere. And where would you get? And where do you get copies of them? Is something you send away for, and you can get a whole bunch of them? Okay. So you had something to say about this book?
Well, that is an excellent book, because it talks about how you need to be alkaline inside. people just don't understand that they need to be alkaline inside, and they're, of course, obviously acidic outside. Well, if everything that we're eating and drinking is acidic, how hard is it going to be for our body to be alkaline inside? Particularly your blood. Your blood, we know, is supposed to be around a 7.365 with pH.
Right.
Okay, now if you're not putting some food in the form of raw fruits and vegetables that can turn alkaline, your body will do that naturally. If everything you're eating and drinking is acidic and not enough raw fruits and vegetables, it's going to be hard for your blood to maintain that pH level. So what does it do? Let's assume you're not drinking this water. Okay, it has to keep you alive because it has to maintain that pH level, and it can't fluctuate very much, about a half a point or a hair more each direction, or you go into a coma and cease to exist. So it's going to take certain things from your body if you're not putting it in and convert that to alkaline to keep that blood pH at the proper level.
And so what are some of the things we see when the body starts drawing, the blood starts drawing? What are some of the diseases? Calcium
is one of the first things it attacks. Of course, bone. It'll take a certain amount of bone, muscle tissue, tendon. It never takes any of that other stuff that we happen to grow out on our tummy now and then, okay? They can't convert that fat to alkaline.
So it doesn't actually,
if
I can jump in, it doesn't actually attack the calcium, but the body in its own wisdom leaches calcium from the bone matrix to counteract the acidity.
Exactly.
And then also, I think through research is that once the blood is acid enough, as it's coursing through some of those tight vessels in the blood vessels, it actually starts nicking the tissue, and that's when the body lays down cholesterol to protect these areas from the acid. But once you go back up to the alkaline level, the cholesterol seems to dissipate.
Right.
And so there's so many more benefits from alkalizing your body, from lowering your cholesterol, losing weight, restoring the calcium balance to your bones, reducing obviously tumors. How about now, we were talking about your tumors went away in 7 days. They were lipoid tumors. They were probably fat deposits that had simply grown up. A lot of people have those, from our diet. If it was a cancerous tumor or a tumor that had metastasized, can the alkaline water affect that also?
Well, I've watched where these things have disappeared, but not in every case, okay? So it can definitely help. It certainly can't hurt. The hard tumors seem to be the hardest ones to be able for the body to get rid of, okay? So if you're giving the body something that can literally get in there and penetrate this cell, it's going to be hard for it to get into something that's really encapsulated and basically growing on the inside. However, there's still something feeding it, so you're going to be getting into the inside through whatever's feeding that tumor. So I've seen some amazing things happen out there. Again, I want to stress, the water's not curing anything. It's just giving the body
a chance to cure itself.
To do what it's designed to do.
Right, and the alkalinity actually inhibits the growth of blood vessels.
That's right.
So it will starve the tumor. It just depends on how healthy that tumor is as to how long starvation will do it. But and it actually being the anti-aging thing, and now you were ill for a while, you had a lot of pain.
Right.
But I know it's not polite to ask a woman her age, but I'm going to ask you, how old are you?
I'm 81.
You're 81 years old.
I want to also tell you, Robert, that I have macular degeneration, and it's the wet kind that I have. I've had it for going on 10 years now. I've had, I won't even begin to count how many shots in my eyes. But about a year ago, a doctor in Idaho and a different doctor in Spokane suggested that I use the 11.5 very high alkaline water and wash my eyes out with that morning and night. And that has helped immensely. In the last 6 months, I've maybe had about 3 shots in my eyes, where other months I had a shot in both eyes every month.
Wow.
So it's really has helped my eyes in a lot of ways.
Well, I know that one of the reason as we get older that it becomes harder to see is because the eye has to expand and contract in order to focus. And as we get older, it becomes less hydrated, and so becomes less flexible. And that's part of the reason. I know that one of the things we can do is because the orbit doesn't change within the skull, but the actual eyeball has to switch. But I found that if you can't see something really well, if you press the side of your head, you actually change the size of the eyeball just from the pressure, and you can see better.
Right.
So it's not an internal problem, it's a flexibility problem of the tissue which makes up the eye. So obviously to me, I'm thinking, well, if I can do this alkaline water, I could probably get rid of my reading glasses, hopefully, hopefully. But it's it's something that it makes sense to me, right? It sounds logical. If we can get hydration in our body, it'll work out a whole lot better. So now the Japanese have been onto this for way long time.
Long time.
I mean, they have, and we don't know about it because we don't translate a lot of medical journals from other languages into English. They're starting to now that we have these instant little translators that we can just plug in phrases and we can get them. More of these books are being translated. I ran into a book about, book written in 1956 by a Japanese researcher about alkaline water, and also run into the fact that, have you ever run into Max Gerson? Ever heard of Max Gerson?
Yes.
Okay.
Gerson therapy and
The
stuff.
Gerson therapy. And basically what his therapy was these ongoing constant vegetable drinks, vegetables and juices, all day, all day, all day. And that's basically, he was doing the same thing. He was alkalizing the body. He was getting the same results as the alkaline water, which was the reduction of tumors, the cessation of arthritic problems and pain and debilitating pain, eyesight problems. His daughter actually was diagnosed with leukemia when she was, I think, 12 years old. She's 93 now and completely healthy. She still teaches the Gerson diet. She still has people come there. So it's basically the same thing. It's totally the alkalinity within our body, because for so many years, I was, thinking, well, this has to happen and this has to happen, and so many times we talk about cancers that we have liver cancer, pancreatic cancer, prostate cancer, brain cancer, but they're actually just one thing. It's a cell that it doesn't know when to turn off.
Yes.
And it's probably because it's been inhibited by whatever process. But so actually there's only one kind of cancer, and that's a cell that doesn't know how to turn off, but the alkalinity will change that, because then it gives it back the information it needs to work, and the body will then eliminate it. Because we shoot off these cells all the time. It's just that when the body's healthy enough, we get rid of it. And of course, it leads us to the point, the fact that way back in the early 70s, I think it was Richard Nixon, started the war on cancer. We've spent trillions of dollars now on looking for a cure for cancer, and every year the cancer just gets worse and worse, and we keep throwing more money at it, when in fact there's a simple way to go. So when you go out and you want to tell people about alkaline water, you have a demonstration you do. And you gather some people together, you do the demonstration. I think that's what, and so we've set up a demonstration to do here on the show. So the second half, we're going to go over to a table over here. We're going to, and Dan's going to run a demonstration along with Joyce, and we're going to see how this actually works and what happens. So we're going to take a little break here for a minute, and we're going to go over here and get set up, and then we'll continue with the show.
Cool.
Okay? So
Thank you.
let's rock and roll.
All right. All right, we're here at the demonstration table, and we've got the demonstration here. This is the machine we were talking about. Here are a group of books that are all about the alkaline water, and at this point I'm going to turn it over to Dan, and he's going to give the demonstration. I'm just going to stand back and maybe interject if I think something needs to be clarified. Dan?
You're on.
Thank you very much. Yes.